What if I told you brisk walking can be a golden key to effectively reducing the risk of developing type 2 diabetes? Walking is not only an easy activity to incorporate into daily life, but also provides many health benefits. Along with combining an appropriate diet and lifestyle changes, exercise also plays an important role for people with diabetes. Walking is a gentle form of exercise, but is highly effective in improving health and physical condition for patients. How is proper walking beneficial for people with diabetes? According to research from Duke University, walking helps people with prediabetes improve glucose tolerance and is beneficial in lowering blood sugar. Specific benefits for diabetes include: walking helps patients control weight, stabilize blood sugar, reduce stress, and improve insulin sensitivity. The main goal of diabetes treatment is to control blood sugar well, keeping levels stable at about 80 to 130 mg/dl when fasting or below 180 mg/dl after meals. There are many ways for people with diabetes to manage blood sugar, including medication, healthy eating, and exercise. Exercises such as yoga, swimming, and walking help the body become more sensitive to the hormone insulin. Below are 8 specific benefits of walking. Controlling blood sugar. Regular walking helps lower blood sugar by increasing insulin sensitivity, allowing cells to use glucose, sugar, more efficiently. This reduces the need for excess insulin production and supports diabetes management. Weight management. Walking contributes to weight loss or maintaining a stable weight, improves digestion, and reduces excess body fat. Obesity is a factor that increases the risk of diabetes complications. Improving cardiovascular health. Exercising for 30 minutes a day and at least 5 days a week brings many benefits to physical and mental health and improves cardiovascular health. Walking helps lower blood pressure, improve cholesterol levels, and reduce the risk of cardiovascular diseases, a common complication of diabetes. Enhancing circulation. This form of exercise also stimulates blood flow, promoting better circulation, which is beneficial for diabetic patients with poor blood circulation. Reducing stress. Physical exercise helps reduce stress by releasing endorphins, stabilizing mood, and lowering cortisol levels that can affect blood sugar. People with diabetes can walk 20 to 30 minutes daily and maintain consistency. Increasing energy levels. Diabetes can reduce energy levels, causing fatigue. Fluctuations in blood sugar also negatively affect energy levels. Regular walking can boost overall energy and combat fatigue associated with the condition. Improving insulin sensitivity. Regular walking can increase the body's sensitivity to insulin, enhancing the ability of cells to absorb glucose and helping control blood sugar. Improving joint flexibility and strength. Joint health is also improved as walking enhances flexibility and strength, which is beneficial for diabetic patients experiencing joint issues. How many steps should people with diabetes walk each day? According to the American Diabetes Association, walking at least 30 minutes or 10,000 steps per day, combined with a healthy diet and proper medical management, can significantly improve overall health for people with diabetes. People with diabetes should not walk on an empty stomach, as it may cause blood sugar to drop rapidly. The best time to walk is within 60 to 90 minutes after eating, as this is when blood sugar levels typically peak. Morning walking can burn up to 300 calories by using stored fat and sugar. It also reduces cravings for sweets and helps regulate blood sugar levels, lowering the risk of type 2 diabetes. Evidence linking brisk walking to reduced risk of type 2 diabetes. According to a study published in the British Journal of Sports Medicine, walking at a fast pace can significantly reduce the risk of type 2 diabetes. Researchers identified 10 valid studies involving 508,121 adults from the United States, Japan, and the United Kingdom. The results include walking at 2 to 3 miles or 3.2 to 4.8 kilometers per hour can reduce the risk of type 2 diabetes by 15%, regardless of walking duration. Brisk walking at 3 to 4 miles or 4.8 to 6.4 kilometers per hour reduces the risk by 24% compared to slow walking. Fast walking or running at over 4 miles or 6.4 kilometers per hour reduces the risk by about 39%, equivalent to 2.2 for fewer cases of type 2 diabetes per 100 people. Each increase of 1 kilometer per hour reduces the risk by 9%. How to walk to control blood sugar. Brisk walking, combined with interval movement within 30 minutes after meals, can help the body use glucose more effectively and support blood sugar control. The factor that truly helps lower blood sugar effectively is not slow walking, but brisk walking combined with interval movement within 30 minutes after eating. In other words, casually strolling around the house or on the street has little noticeable effect. After eating, especially meals high in carbohydrates, blood sugar typically rises quickly and peaks within 30 to 60 minutes. If at this time you exercise at moderate intensity, such as walking briskly for a few minutes, resting briefly, then continuing brisk walking, your heart rate will be better activated, muscles will engage more, and the body will use glucose more efficiently. This form of exercise can help consume about 20 to 30% more blood sugar than steady continuous walking, thereby helping better control post-meal blood sugar fluctuations. Many people think interval training is only suitable for young people, but in fact, it is not complicated. Middle-aged and older individuals can fully adjust the intensity appropriately. For example, you can walk briskly for 10 minutes, stop to stretch, then continue walking briskly for another 10 minutes. This is much more effective than slow, prolonged walking. The important thing is that movement should involve the whole body and should not be done superficially. The best time to start exercising is about 30 minutes after a meal, not too early as it may affect digestion, but not too late as it may miss the golden time when blood sugar is rising. Use a pedometer or other methods to count your daily steps. Track natural activity for 5 to 7 days to observe your average daily steps. Increase your average daily steps by 1,000 steps every 1 to 2 weeks until reaching at least 7,500 to 8,000 steps per day. Set goals. Start with small goals. The final goal can be 10,000 steps or 30 minutes per day. Record your walking history. If you use an app that creates a log, use it. If not, write down the date, number of steps, time walked, and how you felt after walking. Follow safe walking habits. Start with a warm-up walk and then flexibility or stretching exercises. Repeat this at the end of your walk. However, it should be noted that this is not a long-term treatment solution, but only a supportive measure to improve short-term blood sugar control, with effects that can be seen immediately after a workout, especially useful for people with diabetes. Guidelines for walking for people with diabetes. When starting to walk, patients can begin with short durations and gradually increase. In the first week, walk 10 minutes. In the second week, increase the duration by a few minutes, gradually reaching 30 minutes per day, and maintain this habit at least 5 days per week to help stabilize blood glucose. Before walking, diabetic patients should prepare the following. Walking shoes and socks. Choose comfortable, closed-toe shoes that fit well to avoid foot injuries, prevent blisters or sores. Avoid cotton socks. Instead, choose sports socks or diabetic socks made from polyester that wick moisture. Walking clothes. Clothing should be loose, breathable, and sweat-absorbing to make exercise effective, reduce friction causing abrasions, and prevent skin irritation. Wear a sports t-shirt and shorts, warm-up pants or yoga pants. Where to walk. You can use a treadmill for walking exercise. If walking outdoors, choose flat terrain with fresh and quiet air. Check your feet. Inspect your feet before and after each walk for blisters, pimples, cuts, sores, or redness. Because people with diabetes have reduced immunity and healing ability, they are more prone to infection, and any foot injury may heal slowly. Regularly check blood sugar levels. Patients should check before, during, and after exercise to ensure stable blood sugar. If blood sugar is low, eat a snack to stabilize it before continuing. If blood sugar is high, wait until it decreases before walking. Exercise for people with type 2 diabetes has many benefits, but it is necessary to consult a doctor and follow instructions and appropriate adjustments to ensure safety and proper blood sugar control.